this is what we have seen throughout the ABR children around the world, that during this kind of entire COVID period, the children who have been doing ABR actually done very well. So at first, of course, as everyone else, we were concerned, but it turns out that overall, kind of the tolerance of COVID among the kids has been better than even like the typical flus of the past. And there is a good explanation there, right? Because, you know, when it comes to COVID, it's not typical, right? So, and it's more related to the fact that people have troubles with sudden influx of the mucus, which they can't clear out. And as they can't clear out, there are all sort of secondary effects, this matte glass effect and their lungs surfaces that covered and so on. So that's the typical troubles that people experience. But when we talk about the children who are doing ABR, they get the consistent stimulus that gets delivered into the respiratory system. So, you know, they're kind of fresh and being able to deal with that expectoration if necessary. But more importantly, it's not even the visible part, right? I think that I mentioned this before, but it's important to remember that when we discuss the things related to the respiration, you know, when you look at the way how it works, the most important is the absorption through the diaphragm, right? If you think about the total level of kind of liquid and mucus being produced in the lung, it's absolutely staggering numbers. So on average, the person, well, like that's the numbers for the grown up, a person produces something like a 30 liters, 3,000 milliliters of liquids in the or mucus and liquid in the lungs. And you might say, how is that possible? Well, it's as much the same thing as, for example, you are producing about 200 liters of urine every day. So you just don't notice that you're producing 200 liters of urine. Why? Because it's being reabsorbed, and it's only like 0.5% of it, or maybe 1% of it, that actually kind of comes out as the peeing process. So the same thing here is only maybe 1% or 0.5% comes out as being coughed out. The rest is being absorbed via the diaphragm. So as we work at the torso and as we stimulate their entire, you know, delivery, mechanical stimulus for the respiratory system and the abdominal and so on, so that gives us the improvement of those absorptions. So the person, you know, A, doesn't need to cough so much, right? So it's a lot the easier way to get the liquids through. And on the other hand, you know, like the total capacity is well fit and well suited to the situations when he needs to kind of increase that throughput. So that's very, very positive and great to hear.